So my topic is about safe injection facilities. I'm going to give you a brief of pros and cons on basically why safe injection facilities need to be implemented in the U.S. Starting with our overdose rates. Year 2018, according to the Centers for Disease Control Prevention, they reported 67,367 drug overdose deaths occurred in the United States. Today, opiates have become the number one impacting overdose deaths. Of the overdose deaths, 46,802 were related to opiates. States such as West Virginia, Delaware, Maryland, Pennsylvania, Ohio, and New Hampshire have the highest rates of overdose. California, year 2018, they had 2,428 deaths occur related to opiate overdose. According to the CDC, nearly 15,000 people alone died from a drug overdose involving heroin in the United States, a rate of 5 deaths for every 100,000 Americans. So what is a safe injection site? They are supervised injection rooms, legally sanctioned facilities where people who use IV drugs can inject pre-obtained drugs under medical supervision or trained professionals. Supervised injection facilities are designed to reduce the health and societal problems associated with injection drug use. As we all know, our U.S., the country, with the opiate epidemic, it definitely has increased and become a major problem in several communities. The counter argument, so against them, some may say it may encourage drug use and a safe haven for drug users, feel it could be a threat to public safety, challenge federal control laws, and possibly have the government lose control over their drug policies, may strain the government's budget to maintain facilities. Community fears it encourages drug use in their neighborhoods, discourage treatment, challenges federal government, and opening facilities that are in violation of U.S. federal laws. They have biased studies. Some are worried it will increase violence or drug activity around the facilities. Two of the laws that will be possibly being violated. The Federal Controlled Substance Act could be in violation using the facilities. Section 844, which prohibits drug possession, violates Section 856, crack house statute, meaning knowingly open or manage place, purpose, unlawfully using a controlled substance. But as we all know, we are trying to work on decriminalizing drug possession, and I think we need to focus more on a drug treatment and helping individuals who are struggling instead of being more punitive. So some of other countries are actually using these facilities. Information about that with the argument, and this is where we come into where I'm saying other countries are using the facilities and where they are located. So a little background on it. Safe injection facilities, also known in other countries as drug consumption rooms, have been around for over 20 years, which I never even knew they existed. Countries such as Canada, Western Europe, North America, and Australia. According to the International Drug Policy Sydney, Australia reported that the drug consumption rooms reduced drug overdoses, reduced the related problems of injecting in the public and needles being discarded, which I feel like I know in San Francisco we have this problem majorly, where individuals are injecting in the public, needles are being found in public parks where children play. And on the street where we have tours, we have major tours coming in San Francisco, and they're starting to see it more. Back to the PowerPoint, Sydney says they reduced a decline in their HIV and hepatitis C infections. I think also Europe also said they had a decrease in HIV and hepatitis C. Europe reported it helped improve the health and status of people who use drugs, reduce high-risk behaviors, reduce overdose deaths. Same thing, they reduced the use in open places, reduced the impact of HIV and hepatitis C. According to Vancouver Coastal Health, since they've been open since 2003, they reported having 3.6 million people visit and inject illicit drugs under supervision by medical staff. I know this sounds really ludicrous to say, but they've had 48,798 clinical treatments. They've had 6,440 overdose interventions, but without any deaths, meaning that people's lives were saved due to being under the care of medical staff while injecting instead of being out on the streets and possibly overdose and no one there with you and then leading to death, losing a loved one to overdose. So like I said, the argument of them is they increase, some of them will, individuals will have the idea of getting substance use treatment, reduce the spread of blood-borne diseases, like I said, hepatitis C and HIV, sharing syringes, having unsafe sex, reduce the criminal activities, increase public safety, meaning not seeing individuals out on the streets getting high. You walking down the street with your family and you see someone injecting drugs in their arm. It's not really a good sight and not safe. Monitoring frequent on-site overdoses. Like I said, Canada, they reported 6,440, but no deaths. So you have someone who's going to may overdose, but they use like a Narcan to help them come back to life. It's saving costs due to reduction in diseases, overdose deaths, and emergency and medical services, increase in delivery of medical and social services, reduce injection substance use in public places, and like I said, the number of needles, reducing the sharing of needles, of course. Then you have the programs like the needle exchange that does exist, but it doesn't help save lives if someone was to still exchange their needle and go get high and then overdose. I have a short video. I'm gonna see if it allows me to play it.